Good morning, Mr. Jones. Is this Mrs. Jones?
Yeah.
Nice to meet you. We spoke earlier, and I have your information ready for discharge, and I want to go through things with you to make sure you understand what you need to do when you go home.
All right, is this going to take very long? She was just going to take me home.
We have time.
Well, what I want to do, I have some information here. We're going to review how to identify the signs and symptoms that your heart failure is out of control, and then what to do about that.
All right, well, I already know about checking my weight every day and following a low sodium diet, and I call the heart failure nurse if I have any shortness of breath.
We've actually both been trying to avoid salt too. I even took the salt shaker off of the table to help.
Yeah, and if I start feeling too bad, I call the heart failure nurse and she tells me what to do.
Okay, good. What kind of symptoms do you have that typically tells you your heart failure is getting out of control?
Well, usually it's shortness of breath, especially at night when I try to go lay down to sleep.
Okay. Do you ever get swelling in your legs or feet?
No, not really.
How about your belly? Does your belly swell? Do you sometimes feel bloating or nausea, even though you haven't eaten?
Actually, you know what I have recently? I haven't had a really good appetite. I get nauseous when I do eat, and my belly seems to be getting bigger even though I'm not really eating very much.
You even noticed that you had to put your belt loop out once.
Mm-hmm. Do you report these symptoms to your heart failure nurse or physician?
Well, usually the cough or shortness of breath, I call in and let them know, but the cough, the indigestion and, the cough that I've had recently, I just have tried to manage myself.
Okay. I have this guide to review with you that I think will be very helpful in identifying your symptoms and then telling you what to do when you have these symptoms. As you can see, there are three colors on the zone. Green, which is good to go. Yellow, which is caution, stop and consider if you should do something. And then red, which is an emergency, and you definitely should call somebody and let them know. The area at the top tells you what you should do every day just to maintain normal, healthy heart health. One of the things is that you should always weigh yourself every day, which you've identified very nicely that you're already doing that. That you take all your medications as prescribed, that you check for swelling in your feet and ankles, legs and stomach as well, that you eat a low sodium diet, and by that it's 2 grams a day, and read all your food labels, and that you are active and exercise every day. Now beyond that, what you want to do is also identify, are you having symptoms and where does it fit in the zone, whether you're in the green, which is okay, or in the yellow, that maybe you should be considering whether you should be contacting your heart failure nurse for intervention. And certainly if you're in the red zone, you should call somebody right away.
This seems easy enough.
Yeah, this seems really nice.
Did you know that a persistent cough and belly fullness are symptoms that your heart failure is out of control?
I had recently been stopped on one of my medications because I had a cough, and it went away for a while, but then the cough came back. I just kind of thought I had gotten a cold, but I wasn't really having any other symptoms.
Well, as you've identified, many times these symptoms can be related to other things other than heart failure, but they truly are symptoms that your heart failure is getting out of control. As the fluid builds up in your lungs, it also builds up into your belly and can cause some of those symptoms. So it's most important for you to be able to identify what symptoms tell you that things are getting out of control so that you can notify your heart failure provider, whether it be your nurse or your physician.
I thought I was doing pretty well managing my weight at home.
He writes it down every day.
Yeah, you have been doing a good job doing that. However, as you can see, that's only one part of taking care of yourself every day. Let's review these heart failure zones and action plans together. Remember, every day you should, as we talked about, monitor your weight, take your medications, and be active.
Do you think you can do this? It seems pretty easy to use.
Yeah, it seems pretty easy. I mean, I weigh myself every day, but I need to weigh myself in the morning after I go to the bathroom and before I eat any breakfast with the same amount of clothes on. Need to take all my medicines as they're prescribed, check for swelling in my feet or ankles, but mostly in my belly, check for shortness of breath. We need to make sure we're doing a good job of following the low sodium diet, and then we probably need to be active.
So, Mr. Jones, can you tell me again, what were the symptoms that we discussed today that told you that your heart failure was getting out of control?
Well, shortness of breath, if I feel bloated in my belly or start to get nauseous, or if I have a cough.
And what should you do when you have those symptoms?
I'm going to call my heart failure nurse or my doctor.
Great. Do you have any other questions for me?
No, this has been really great.
This is wonderful. We'll definitely put this on the fridge.
Sounds like a good place.